Hi and welcome to another episode of Hair Talks by Terra Medical. My name is Dr. Joshua Chong, and today we'll be talking about the impact of alopecia areata, which is an autoimmune hair loss condition on patients. So let's just do a quick recap about what alopecia areata is. It is an autoimmune condition, which means there are a collection of white blood cells creating autoantibodies to the hair follicles and destroying the hair follicles or putting them in a dormant stage, resulting in discrete patches or sometimes total loss of hair. So when the hair falls out on the microscope, you can actually see that alopecia areata presents as a completely hairless area, sometimes with very short broken hairs at the surface, but macroscopically when you zoom out, you actually see it to be a bald surface. And this can affect people to varying degrees, such as alopecia areata simplex, which is just one spot of alopecia areata that can vary in size. The lifetime risk of getting alopecia areata is about 1 to 2% per person for their entire life. And this can recur in certain individuals, all the way to alopecia universalis, which is the complete loss of hair and eyebrows, beard hair in an autoimmune fashion. I really want to highlight that this is quite impactful from the emotional point of view in patients who have recurrent alopecia areata, especially in the more severe forms such as alopecia areata multiforme, which is multiple spots of complete baldness forming across the scalp due to this autoimmunity, or alopecia areata totalis or universalis, in which their whole scalp or even their eyebrows and beard are involved. So in certain folks, they can find this really embarrassing if the lesions are very visible or very large. Sometimes it restricts certain hairstyles. You can't keep really short hair because it's fully exposed. If you have long hair, sometimes there are ways to style it to cover that up. And they do take great efforts to style their hair just to cover up some patches of hair loss. And they're frequently asked, let's say by their hairdresser or someone close to them, why is there a patch of balding on your scalp? You should get it checked up. Is it some kind of infection or is it transmissible? And this makes people even more concerned about it. I do have some patients coming in and telling me that, I find that this is pointless, that we keep having to go through this over and over again, and I want to reject treatment and I do not want any further treatment because this is going nowhere. So the diagnosis of alopecia areata is usually made clinically if it's a simple spot, but sometimes when there are diagnostic uncertainties, we might use something like a biopsy to be very confirmatory about what's going on under the skin at the hair follicle root. So what a biopsy is we take a tiny punch about 4 millimeters wide and we send it to a laboratory where a pathologist or a dermatopathologist will actually dissect the tissue and look at it under a microscope with certain staining, and that will tell us whether or not the alopecia areata is either in its acute phase or sometimes it's not alopecia areata. It could be a different kind of scarring hair loss, such as morphea, for example, which happens in systemic sclerosis, or is it chronic burnt out alopecia areata? And the treatment options vary from person to person. So by default, what we would use would be a combination of using a growth booster such as minoxidil, sometimes topical steroids such as applied clobetasol, or even the combination of both, or injected steroids such as triamcinolone acetonide. These patients actually need to be monitored quite closely to ensure that the disease is not progressing any further, and also that there's some degree of recovery over a period of time. Ballpark figure I would give them is somewhere between 3 to 5 months to allow for some degree of recoverability, and for the hairs to grow to their original length, depending on what length they kept their hair, it might take a certain number of months. Now, of late, there are more advanced treatments such as JAK2 inhibitors. These are taken orally, and usually because they are quite new to the scene, they cost quite a bit. The typical example would be baricitinib, which is an orally administered drug which is quite new to the market and therefore does still cost quite a bit. The monthly outlay can range between $1,000 to a couple $1,000, and this treatment needs to be carried out for a longish period of time, maybe even years, to ensure for full growth of hair, or at least adequate growth of hair, and even might be even longer if the evidence suggests that in further studies to maintain this hair growth. So alopecia areata, being a disease that can potentially be recurrent, has a significant emotional impact on some of our patients. And if you're experiencing alopecia areata and you're finding it quite recalcitrant to treatment, Please leave your experience in the comment section below. And to find out more information about alopecia areata, you can go to our website at terramedical.sg, or you can leave your questions in the comment section below as well. Don't forget to click like and subscribe for more information on hair loss and hair restoration topics.